Hello and welcome to our Wednesday show. Coming up, one educator says that in this age of video, students don't think the way that they used to. And writer Lisa Birnbach understands kids these days, and she's going to be with us to talk about what they really want to know about colleges. Christina's mother gave her new ears for her 8th grade graduation, and Danielle's mom offered to pay for breast implants for her 14-year-old daughter. Now, it may sound crazy, but plastic surgery is becoming more and more common among teens. Is this an example of a sick society, so consumed with appearances that kids are going under the knife? Or is this an enlightened way of helping boost fragile teen egos? Dr. Sherrell Aston is Surgeon Director with the Manhattan Eye, Ear, and Throat Hospital. Dr. Michael Nicolai is the Medical Director of Cosmetic Care Plastic Surgery Specialists of Long Beach and Santa Ana, California. They're here to discuss this with us today. Dr. Aston, this is such a fragile time for teenagers. When they see themselves through the eyes of others, is there really anything wrong with improving upon the insecurities by allowing them to go under a surgical knife?
Well, certainly, I think you have to use very conservative judgment in selecting aesthetic surgical procedures for teenagers. Certain procedures, such as rhinoplasty, have been done for over 30 years, particularly in the Northeast. Some of the other procedures that are currently being done on teenagers in some places I wouldn't agree with. Breast augmentation, liposuction. I think teenagers are ready for these procedures psychologically and anatomically.
Dr. Nicolai, do you agree?
I somewhat agree. I don't agree with the breast augmentation in that a teen is fully developed usually by the time they're 18 to 21. If an 18-year-old is requesting augmentation mammoplasty, I think you have to individualize, analyze that patient, and it appears that they're psychologically ready for that surgical procedure and their expectations are realistic. I think you should offer it to them.
Let me ask a little bit about the youngest age that you would consider doing something, Dr. Aston. For example, we know that kids who have large ears may really suffer the results of that at very early ages, maybe even before they're in their teens. Would one ever consider doing a procedure before a teen?
Well, otoplasty, or correction of protruding ears, Sonia, is really the only procedure that is frequently recommended for teenagers or pre-teenagers. The ear is more than 90% developed when the child is roughly 6 or 7 years of age. And it is approximately that time that the friends, the peers at school, start calling them Dumbo ears, elephant ears, and that type of thing. So an otoplasty for someone younger than a teenager would be an appropriate operation in selected patients.
Dr. Nicolai, you are in what is often called the center of youth and beauty, and certainly a center in which parents might push young people into surgery in order to make them more marketable, either commercially or in terms of just being able to make themselves more competitive in marriage. Is that something you ever concern yourself with? That is the objective of the surgery, why it's being done, and who's behind it?
Absolutely. I think it's critical. When you do a consultation and a mother comes in and has a lot of negativeness about that child. Oh, my child has no self-esteem. My child is homely. None of the kids like my child. She's a problem child. She gets poor grades. Could you do a rhinoplasty on her, or could you do liposuction on her? I think that would be a mistake. That individual has many seated problems that a psychologist or a psychiatrist may be able to help. Just doing a rhinoplasty might have that patient turn towards you and say it was your fault. That rhinoplasty was the root of all problems. So I think you have to take each individual and analyze them. Although California is a mecca for a lot of cosmetic surgery, I think we're Dr. Aston in New York, California, Paris, it's kind of all over the world today that more and more people, including teens, are requesting some type of surgical intervention.
Well, of course, the child is below age, and I don't know if you need the consent of the parent. It would seem to me you certainly would in order to be able to proceed with this, but it also could be that the child could change his or her mind. And let me just say, there was a time where I'm sure a woman like Barbara Streisand, it may have been suggested to her that she have a nose job. She resisted that, and there may have been people who came in and wanted Barbara Streisand's nose. The idea that there is one scheme of beauty distresses me. Different ethnic groups have different standards, I would hope, for beauty. Isn't there something wrong with us narrowing it down to one, Dr. Aston?
Well, I don't think, Sonia, that we actually really narrow it down to one. And I agree with you, different ethnic groups have certain characteristics that they see as attractive in their ethnic group. But there are certain characteristics, such as a large nose, that across the board, many people within ethnic groups like to have changed to a more attractive profile. And I think this is an acceptable procedure to help teenagers feel better about themselves.
Look, let me just use that and jump off of that. Dr. Nicolai, we understand that a number of young Asian females, and maybe males too, are asking to change the shape of the eye. The almond eye has been a source of great beauty, but it is not a Western eye. Do you think that it's a reflection of a lack of acceptance when someone from a group like this asks to change in such a fundamental way?
I think you can get both walks. There are some individuals that come in, some Asian patients that want to increase what's called the fold, the upper fold of the eyelid from the lash to the first crease. In an Asian, they're anatomically different than the Westernized eye, and you're trying to create a small 2 to 3 to 4 millimeter fold there, enabling them to put a little makeup there. Now, there are some individuals that come into our office, Asians, that want truly to look like a Western individual, and that's quite difficult. I think you have to analyze that patient as you do each individual
Dr.
patient.
Nicolai, let me present you with a hypothetical 16-year-old female and tell me what you wouldn't do to her, even though her parent might give permission.
I'm sorry, could you repeat?
Tell me what you would not do.
What I would not do?
Yeah.
I read a recent article in the Wall Street that said that somebody was doing facelifts on teenagers. I mean, I think that's absurd. I've never done in 10 years doing over 1,000 kisses a year, I've never done a facelift on a teenager electively for cosmetic. Dr. Aston does a lot of craniofacial, and in his practice, that would probably be an appropriate procedure. But not in my practice.
I would think only for reconstruction, just as I know in my reputation, which I happen to. So I would think that would never occur unless there was a terrible accident and you were doing that kind of reconstructive surgery, correct?
Sonia, I would never perform a facelift on a 20-year-old or a 16-year-old. It's not an appropriate procedure at that age.
Let's do this. I would like to ask the parents out there, maybe some who would be open enough to admit that they have considered this of their children or that they have gone ahead with this. Under what circumstances would you do it? And perhaps if you're considering it now, why? 212-714-7810, join me. We are talking about plastic surgery for teens. Dr. Sherrell Aston is the surgeon director at the Manhattan Eye, Ear, and Throat Hospital. Dr. Michael Nicolai is the medical director of cosmetic care plastic surgery specialists of Long Beach and Santa Ana, California. Dr. Aston, before we continue, this is a competitive field. There may have been one time where there were not a lot of plastic surgeons. Everybody had a great business. But I have to tell you from personal experience that I know that it is not unusual for plastic surgeons to make suggestions about what a patient might want. Now, would you say that that's an ethical behavior, and that if a mother, for example, took a child and asked about a rhinoplasty, no surgery, and then a suggestion was made about liposuction or about filling out the lips, etc., that you take your kid and you run out of the office?
Well, Sonia, certain suggestions would be appropriate and certain suggestions would not be appropriate. For instance, if the teenager was requesting a rhinoplasty, but the main problem was a chin that was actually quite weak, then to suggest a chin implant at the time of the rhinoplasty would be an appropriate suggestion. But to suggest that the patient also have larger lips or liposuction of the abdomen or the thighs would not be an appropriate procedure. And I think that most of your surgeons, board-certified plastic surgeons, would not make those kinds of recommendations.
Let's go to our phones and say hello first to Bobby in Mississippi. Hello, Bobby.
Yes, ma'am. I think that we deal with people with low self-esteem, and
well, I think that you can stop at that point. You really have made an important point. Dr. Nicolay, surely there are people who come for surgery, and they are equally as unhappy after the surgery is over as they were before it occurred.
And that's why I think you have to be very, very, very selective with your patients. When you evaluate a patient that has an irregularity of the nose, you have to make sure that when you're evaluating that patient, that they're really trying to correct a problem with self-esteem, not a problem with a recent loss of a boyfriend, poor grades, doing poorly with their colleagues. These things are not going to change, and I think you have to go beyond being a plastic surgeon often. You somewhat have to be a psychologist and analyze the entire patient.
Dr. Aston?
Certainly, I would agree with exactly what Dr. Nicolay said. But let's look at what reality is in our society. Reality is that people who have better self-esteem, better self-confidence, react better in society. And the other side of the coin is another head. Society, in turn, reacts better to people who are attractive, who have self-confidence, and better self-esteem. And many of our role models for establishing what looks good are attractive people. Movie stars, TV personalities, who themselves do what they can to look good. You have beautifully coiffed hair, applied makeup. And these are the kinds of things that teenagers as well as adults see.
Right. So then how do you draw the line down the middle of how a teenager views him or herself, Doctor?
Well, that's a very difficult question. And that's exactly what Dr. Nicolay is saying. You do have to be part psychiatrist or a psychologist in evaluating the patient and the family relationship.
Right. Let's talk a little bit about the family relationship. We'll get back to that. Kim from Florida with us now. Hello, Kim. Welcome.
Hi, Sonia.
Yes.
I have a daughter who's 16 years old, and she broke her nose a couple months back. Her nose turned into like your basic Paul Parrot nose, and it really bothers her a lot. We consulted a plastic surgeon, and he agreed, but he only agreed because she was having trouble breathing out of her nose.
Well, are you feeling guilty about that, or are you somehow feeling that maybe it wasn't the right thing to do?
Oh, no, it was definitely the right thing to do, but it was right because it was needed to be done. But, most teens go through a phase where they don't like their chin, or they don't like their cheeks, or they just don't like something about them. But, I would say give them a while, let them think about it, and, I think if everything is explained, like the amount of pain they're going to go through and everything, a lot of times, as their face continues to grow, they a lot of times low out. Everything comes into the proper proportion.
Thank you for your call. Let's go to Jerry in California. Hi, Jerry.
Hi, I'm from Los Angeles, and I come from the land of beauty over here, and I'll tell you, there are so many fake breasts in L.A., it's like no big deal now anymore. I would like to see these doctors call for a moratorium. If they're not in it just for the money, to call for a moratorium on plastic surgery on children under 18.
Dr. Nicolay, how do you feel about that?
That'd be pretty tough to do, number one. But number two, you see a lot of deep-seated problems in adulthood. For instance, I do rhinoplasties on 30-year-olds, 20-year-olds, 40-year-olds, and they relate back to their teenage years, and they're deeply marked with this problem that kids have teased them about. Now, I think if you take an honest patient that really has a bona fide deformity, a hereditary or a congenital problem, for instance, that little saddle nose deformity that was congenital rather than traumatic, and if you can help that patient before it becomes deeply seated as a psychological problem, I think you can get a few individuals that would benefit in their teens by intervening.
I agree with much of what Dr. Nicolay said, but to address the call that came in, actually in the United States, only about 2% of the breast augmentations are done on patients that are under 18 years of age. And some of those are done for patients that have an asymmetry of their breast, where one breast is very small and the other side is quite large. and a young lady needs this in order to just balance her body so she can wear clothes appropriately. But I personally still don't think that routine breast augmentation for teenagers is an appropriate procedure.
Let's go to Judy in Missouri. Hello, Judy.
Yes, I have an 18-year-old daughter who has a nose problem, and she has talked with her father and I several times about having nose surgery done on it. It's a hereditary thing. It's a bump in the top part of the nose.
What's your question?
We wanted to find out if you think that taking her to someone now and having her checked for that type of surgery, since she is this old now and she has pretty much grown as much as she has.
Well, you both have agreed. Thank you for that. I think both of you have agreed that that's okay. I mean, certainly rhinoplasty is the least of it in terms of the fact that it's a wonderful result, can be very helpful, and often can correct what is a minor problem, making someone feel good. But I want to ask one last question of you, Dr. Aston. This is a fast-paced society, and in 30 seconds, which is all we have, aren't we also teaching people not to cope in some ways when we give them this kind of fast response as a teen?
Well, Sonia, I don't think we're really giving them a fast response as a teen. They're going through a phase in their life that they have a problem that they'd like to have taken care of, just as they have their teeth straightened, just as they see an orthodontist. And if we're talking about rhinoplasty or otoplasty, the procedures that I would think are acceptable, then I think we're helping them through that time in their life and on into adulthood with very good self-esteem. And I think we have to carefully select patients for these procedures.
Okay, but I think I also heard you say that if it overdevelops them in some areas, it gives them unrealistic standards, that you may want to examine that very carefully.
We do want to examine patients very carefully. We like to know the psychological motivations behind their decisions.
I thank you both for being with us today.